Good afternoon, brothers and sisters. This is Rachel Seller, the forensic nurse, exposing medical crime one misdiagnosis at a time. Today is March 27th, 2020. I have a very special guest with me today from Seattle. We have Dr. Darvish Nooshin, and I'm so happy to have you. She's out in Bellevue, Seattle. Welcome, doctor.
Hi, Rachel. Thank you so much for inviting me. This is very exciting to discuss these topics with you.
So I ran into Dr. Darvish on the cyber streets on LinkedIn, and she posted something. First of all, I love the name. Holistique is so cool with a Q. And I seen that she posted something about lasers. And when I did my naturopath training, one of my professors in Malta was actually treating Lyme disease and herpes and AIDS and different things with light therapy. And once I seen that, I was like, I have to talk to you.
Fantastic. Well, I'm out here in Bellevue, Washington, and I've been practicing for almost 25 years. So I graduated from Bastyr University and got my license as a naturopathic physician in '95. And then I did a 2-year residency in naturopathic family medicine, and then a couple of fellowships, one in integrative cancer therapies, and then the other one in anti-aging and regenerative medicine.
Wow, that's so awesome. I was at an integrative oncology conference in 2018, and I did want a picture with Dr. Mercola, and it was just funny because like he happened to be walking up, and I got my picture, and I remember the theme being cannabis, keto, and something else was the theme.
Yeah, I mean, those integrative oncology conferences are fantastic because we are looking at the whole person and not just focusing on the conventional therapies of chemo and radiation, but looking at what we can do to help the immune system to counteract the side effects of the conventional therapies, looking at diet, looking at the pH of the body, looking at the mental and emotional wellness, just looking at the whole system to help the body overcome the cancer in as many ways as possible. So I personally have had experience with cancer in my family. Wow. And we've had, excellent results. So it's a pleasure and an honor to be able to help as many patients with cancer as possible.
Well, let me just back up real quick. And I want to tell you a little bit about me. And when I was in nursing school, when I had this aha moment, I remember struggling myself with addiction, and Adderall was, obviously it's always been very popular. The demands of nursing school and medical school can be very hard. So Adderall is very addicting. And there are there's another student who had an addiction to an opioid, but I remember crashing at the end of nursing school. Like I didn't sleep for days, and I was under so much stress. I remember confiding in my professors, my nursing instructors at the time, and I feel like it was kind of used against me. And I realized that I felt like nursing wasn't what I thought it was. But when I asked one question, I said, why aren't we testing people with addiction and schizophrenia? Why aren't we testing the neurotransmitters? And her answer was, remember, this is Western medicine. So I wanted to know what was at the root cause of my addiction. And I knew there had to be an answer. I said, we can't be that, are we really that behind? Come to find out, Dr. Marvin Spinagle is actually famous for treating Lyme disease. He's in my backyard. He showed me PET scans of people's brains were full of mold. And the triglycine gas the mold releases can cause fibromyalgia, depression, schizophrenia. All these people I would say, they're all misdiagnosed.
Well, I do believe that we need Western medicine for emergency, urgent care. But 95% of our lifetime is spent in non-urgent and non-emergency situations. So if we can transform our bodies and our beings through more of a holistic medicine, then we won't need the prescription drugs, we won't need as much of the surgeries, and we won't need the side effects of all that those medications and procedures pose. So I think both are needed, but just in complementary to each other. And that is what I practice. So most of the time, I would say probably 98% of the time, I'm seeing patients and prescribing more holistically minded kind of treatments and procedures. And then maybe 2% of the time, I'm actually prescribing pharmaceutical medications just to pull them out of that emergency mode when they need it. For instance, asthma, if you're in an acute asthma attack and you're about to, go blue, you need something to pull you out. And this is what we're dealing with right now with COVID, right? We are looking at patients who have COVID infection. Actually, it's called SARS-CoV-2 infection causing COVID-19 disease, right? And once it progresses to a point where it is causing fluid buildup in those bronchioles, that's when we need the emergency care. In fact, I don't know about your state, but in my state, the Department of Health has said no one goes to the hospital unless they're turning blue and having trouble breathing because they're turning blue, or they're turning blue because they're having trouble breathing. And so from the point that you actually may be exposed to the virus until the point that some people, not everyone, very small percentage, do turn into that pneumonia and into that difficulty breathing, there is so much more that we can do other than hydrate and just sit and wait. So I'm not a proponent of just sitting and waiting. I'm a proponent of being proactive in transforming ourselves and looking at what else can we do to address the root causes, the shifts that need to happen in order for us to feel better and not necessarily go down that pneumonia and the shortness of breath pathway. So that's what we look at. And there's so much people can do. Unfortunately, it's not out in the media about all the things that we can do to support our immune system. And if you think about the people who are at risk for pneumonia and these high-risk situations with COVID-19, it is mainly people who have some kind of chronic disease, whether it is diabetes, high blood pressure, insulin resistance, metabolic syndrome, heart disease, autoimmune diseases, something where they're either on an immune suppressive medication or are on some type of medication that opens up these, what's called the ACE2 receptors in the body and attracts the COVID even more. So if we can only start working on those symptoms or those conditions now by helping the body reverse the blood pressure, by helping it reverse the blood sugar and the insulin resistance and the heart disease, and hopefully get patients slowly reduce their prescription drugs once they are feeling better with a provider that knows what they're doing, then we're reducing globally, we're reducing the risks for COVID-19.
One thing I want to say, two things I want to bring up. One is the ignored pandemic of Lyme disease. And Dr. Kenneth Stoller taught me about this. So it seems like no matter what in the population, we're dealing with Lyme, we're dealing with viruses, it's infectious disease and mold. So like if you want to kill bugs, if we want to kill mold, what are some of the natural treatments that are available? We have mold toxicity, Lyme disease, which I've seen you have that on there, we can do.
Well, so I see a lot of patients with chronic infections, including chronic Lyme, or we should say multi-system infectious syndromes, mold illness, mycotoxicity. And I will tell you, majority of patients with a lot of these chronic diseases, diabetes, high blood pressure, cancer, metabolic syndrome, insulin resistance, whatever, stress plays a big role, and that contributes to immune system becoming weaker and allowing for a lot of these infections to take over. And what I understand from European biological medicine is that we're not trying to kill things off. We're trying to bring things back to balance, right? So I always bring up this analogy of the soil. If you think about the soil and in your garden and you correct the pH, you feed the soil the nutrients it needs, your plants will grow vibrantly, right? But if you sterilize that soil, most of your plants will die.
Right.
And so we need the bacteria. We need all of these bacteria. They actually stimulate our immune system to do work. These bacteria are involved with balancing hormones and neurotransmitters, your mood, your energy, your immune function, your digestion, your absorption of nutrients. Some of them even produce nutrients like vitamin K2. So our body needs these bacteria, but the key is how do we work at bringing it back to balance instead of allowing one of the infections to take over.
You're so right.
The key.
Whole pH thing. So okay, so like the chronic deficiencies, for example, like with functional medicine, what I was trying to teach everyone is that if you want to get to the root cause, people will say, well, I went to the doctor and they ordered my thyroid labs and everything is fine or everything is normal. Well, functional medicine looks deeper into the picture. They'll say something like a reverse T3, or they'll look at your T3 and T4. And when those numbers are out of whack, they can often tell things like your selenium is deficient or iodine. So I just find that part fascinating about lab work, because I think we have a really big disconnect. Number one, ordering the wrong test. Okay, what are you looking for? And then number two, say, well, the results come back and I'm fine. Well, he was looking for the whole wrong thing in the first place. You know what I mean? So like maybe the right test wasn't ordered.
Well, the tricky part with a lot of these chronic conditions, including COVID, it being more complicated than some of the other viruses in terms of the symptom progression, is that these infections are often hidden. They're in hiding. Some of these infections, and I'm not talking about COVID in this case, but some of the infections like mold infections or Lyme-related tick-borne infections, these infections are often hidden, and they're hidden in fatty tissue, in the nervous system, in the muscles. And so we don't necessarily see a reaction going on in the blood. But what we're seeing is pain and numbness and tingling and neuropathy. We're seeing fatigue. We're seeing all of these different symptoms that are more at the organ level versus at the blood level. And
Right.
So when you're looking at the blood level, most of the time, we will miss the infection because the infection is not roaming around in the blood. It's hidden in the tissues like the brain or the nervous system or muscle or what have you, or digestive tract. And so the key is actually knowing as a physician what laboratory markers are we looking at that are a signal to the inflammatory response that this thing may be causing. So I may not be able to identify directly that this is, Bartonella or Borrelia or Babesia or whatever, but I can look to see if the laboratory tests are pointing that way, where it's pointing towards an infection that is awake. One example, for instance, that I will bet you majority of doctors don't look at, is just a simple CBC and looking at the ratio between neutrophils and lymphocytes. So neutrophils are the white blood cells that fight bacteria, and lymphocytes are usually what activates the response to a virus, right? I'm talking about, just big picture. And so what we like to see is a ratio of 3:2 between the neutrophils and the lymphocytes. Oftentimes patients come in here, they've got chronic symptoms going on, like chronic pain or chronic fatigue or what have you. And the CBC, the number of neutrophils is normal, the number of lymphocytes is normal, the white blood cell is normal, but you know what? The ratio is off. So instead of being a 3:2 ratio of neutrophils to lymphocytes, they've got a 2:1 ratio, which again tells me that there is an infectious process going on. So we're looking at these markers in the blood at a much finer level than most doctors would look for diseases. We're looking at dysfunction and how the body is actually naturally responding to an infection. Another example is, for instance, this COVID-19 issue. We know that they get to a point, if they get really sick, where they're getting a cytokine storm, right? So the cytokine storm is basically your immune response really going at it, trying to really kill whatever infection disease is coming at it. And as the immune system is going at it, it's producing all this pus and inflammation. And that's what really gets patients into a deep trouble. Now, if you think about people with high blood pressure or diabetes or cancer or heart disease or any of these chronic diseases, even chronic multiple infection syndromes like tick-borne infections like Lyme or mold infections, these people already have an elevated level of IL-6 or inflammatory response, responding cytokines in the first place. That hasn't been necessarily controlled because they're either not on the right treatment or they're not being looked at that way or the diagnosis was missed or what have you. And so you've got these people having already an inflammatory response going on in them, which by the way can be caused not only by your environment, but by the food that you're eating, right? And by the exposure to electromagnetic fields, and the list can go on. These toxins can cause these inflammatory responses. So you're already, these people are already at a level up here. And then you add in the COVID infection, the SARS-CoV-2 infection. Now you've got double whammy, and the body says, burnout, I can't handle this anymore. I don't have enough of a capacity to keep fighting like this. And they go into this explosive mode we call cytokine storm, and then that's it. They've had it, right? So it all goes back to starting from the baseline, looking at the inflammatory response in the body from other things that has been happening, like your diet, like the exposures to chemicals, like the electromagnetic field toxicity, like your nutrition, nutrients that are you deficient or in excess of, like the emotional. Emotions is a big deal. Right now we're in a fear mode all the time. And we need to get people down off of the fear mode, because the more fearful you are, the more inflammation collects in our body, the more cortisol levels, the stress hormones go up, which creates more of an inflammatory, or I should say even more of an immune suppressive state.
Yep.
Well, then that throws them into, being more susceptible to some of these infections. So it's really looking at the whole picture versus just looking at the end result, which we say, oh, now we've got COVID-19 and they're in the hospital, shortness of breath and pneumonia, and what do we do now? Ventilate them, right?
Well, one question I always ask is, vaccine injury for number one seems to be an ignored pandemic in itself. So I always ask, if someone died or is on a ventilator, when was their last vaccine, number one? Because my whole thing is, the people that come to find me are vaccine injured, most of them. I see dysautonomia, I see autoimmune disease, I see metal toxicity, metal in the brain. So when we look at the root of this stuff, it's like, what are some of the therapies that we come to see you we could do, like the ozone and the light therapy for, for me, I don't want allopathic medicine if I were sick, because I'm really a natural girl. So if I can get these treatments and therapies, what are they? Like, tell me about the ozone a little bit and the light.
Well, there's a lot of different things that we do, and we do it more based on the individual and their whole picture: physical, mental, emotional, biochemical, energetic, genetic, ancestral. We're looking at the whole picture. It's not always just one thing. And so for me, I can't tell you that a patient comes in with COVID-19, I'm going to treat them the same as the next person. Every one of them is going to get a different treatment, because their baseline, like you mentioned, they might have been exposed to vaccines, they might have had other issues going on that have been a toxicity to their system. Yeah. And what do we need to do to clean that up, to free up their immune system so that their immune system can fight this current pandemic that's going on, right? So there's a lot of different things that we do. Some people, I just do emotional clearing, because that is the baggage that is switching their immune response to a negative mode, right? Yep. Suppressing it. There is electromagnetic fields for some people. There is heavy metal toxicity for some people, and chelation may be indicated for some people, and vitamin C may be indicated for other people, and glutathione intravenously may be indicated for others, and simply zinc and B12 may be indicated for other people, and B6. So it's really individualized treatment. There is, ozone therapies that are very, very popular in Europe, and they're gaining some popularity in Europe, in US. There is different types of laser light therapies that are again becoming more popular in Europe and gaining some momentum here in US. There is oxygen therapies, hyperbaric therapies, cranial work, structural work, manipulation, injection therapies. There's all sorts of different things. Most of them are branching out of Europe, and the doctors over here in North America, mostly the integrative doctors, which means that doctors who are educated in the science of medicine, so we're licensed physicians, whether it's in naturopathic medicine or Western medicine or what have you, but we are open to looking at what else can we give the body in order to correct the imbalances that are going on in the body. And what can we do in some more urgent conditions? For instance, one of our doctor friends with the Ebola epidemic that was going on in Sierra Leone, he and his friend took their ozone machines and went down there and trained a bunch of nurses and doctors how to do ozone therapy. And before you know it, the whole area within a few weeks was cleared of Ebola. And we didn't hear anything about Ebola after that, and we didn't hear anything about the fact that they were doing ozone therapy to shift these people. So there's a lot of hidden kind of treatments that are much more geared at looking at the whole system, oxygenating the system, reducing the toxic load, that are really effective in some of these cases of pandemics and epidemics. The problem is that majority of us in the integrative field are not in the hospitals. And most hospitals here in the US at least are not willing to go out of the conventional route of treating patients with intravenous vitamin C therapy. Or although, we're hearing some things coming out of one of the hospitals in New York trying low levels of vitamin C, which is better than nothing, but really the Chinese found that a higher level of 10 to 20 grams is much more effective in shifting COVID for even the ICU, the critically ill patients. So there is a lot of treatments that are available, but unfortunately the public doesn't have access to them because of the way our medical system is set up right now. From an integrative perspective back here, we're trying to do more preventative for patients so that if they are exposed, they're not getting sick. And I'm finding, knock on wood, I have to knock on wood, my patient load right now, and we've got a big patient load from 25 years of practice, that I haven't seen them get sick with any of this, at least in our patient community. And I attribute to the fact that they're doing a lot of work from the baseline of reducing inflammation in their bodies. And so the virus may come as a cold and then it goes, but they're not getting super sick from it. So I'm hoping that that will continue in this patient population of ours. And I think one thing I may do after this whole thing is done is to send out kind of a survey to our patients and see how many of them actually got sick. It would be a really interesting analysis to see the patient's community from an integrative practice where we're looking at the imbalances in the body. How many of them actually got sick?
That's a really good thing. I have a really tricky question that I wanted answered. So when I went to the Integrative Oncology Conference in 2018, one of the PowerPoint slides that I got was about the hydrogen. So with the electromagnetic frequencies, I want to just get to that whole inflammatory cascade thing about the calcium channel gates firing, setting off this whole reaction. And then I've heard that we're deficient of hydrogen in the cell and deficient of the potassium. So how the Wi-Fi affects our cellular voltage and our oxygen and pH.
Yeah, the whole nervous system is all electricity, right? And so we're looking at high voltages or electromagnetic fields from cell phones, computers, what have you. coming at us, and they create an interference in in our nervous system. Basically, our nervous system is not doing its signals properly because of the interference. I mean, you can see that. I think any physicist or any kind of electrician or electrical engineer gets that. That when there is when there's a magnet, it's going to interfere with the electrical circuitry of the body.
Yeah,
And
so
so that's what we're seeing, right?
they were talking about the hydrogen water and these people that were ill, but we have to dig deeper and look at these layers that are not being taught in nursing school. Okay, like when I went to nursing school, one thing that I was really upset about, and I want to finish on that cellular voltage thing, is GMO foods. There was a study done in Europe, and they held up the rats, and they were riddled with cancer and tumors. The genetically modified food was one of the admitted that from Elsevier publisher in my nursing textbook that I bought. And I said, nutrition is the foundation. And that I didn't find that out till later, but I said, these people are inflammatory, and the GMO weaves a fungus into the DNA of the corn. And then we have the gut issue. No one's being taught that. So how could you really get to the root of that, you know?
Well, I think it depends what school you go to.
Right, and that's right.
Right, you will be, I mean, if you're a naturopathic physician being trained at one of the accredited universities throughout the country and Canada, you're going to learn a lot of those kind of things at the biochemical level. Yeah. And how to intervene to help the body heal. Hydrogen is an essential molecule for the healing of the mitochondria. And so when there is hydrogen deficiency, the mitochondria doesn't get a chance to repair itself. It's actually a very simple process. But we are not looking at that from a Western perspective because the training is different. So, and you know, most people out there don't recognize that the training that naturopathic physicians go through is very close to what Western medicine doctors go through. We still have to go through pre-med and 4 years of undergrad. We still go through 4 years of medical school. The first 2 years are basic science like pathology and neurology and dermatology, all of those sciences that we need to know. And then the last 2 years are more clinical, but we're not only learning about minor surgery and pharmaceutical medications and how to prescribe those, but we're also learning about the hydrogen molecules and how do we treat these patients with hydrogen, or how do we treat them with oxygen therapy, or how do we treat them with vitamin therapy, or herbs, or botanicals, or homeopathy, or emotional counseling and manipulation, similar to osteopathic and chiropractors. So we are learning not only the Western aspect of it, but also the holistic aspect of it, and then go through board examination of a week long, both for the sciences and the clinicals, before we're licensed to practice medicine. And so in the state of Washington, we have full rights to practice, diagnose, and we're primary care in the state. And so patients come in here, we run blood work, we order imaging if we need to, but at the same time, we're looking at their nutrition, we're ordering functional tests, we're looking at the mold and toxins that produces, we're looking at the electromagnetic fields. So it's a lot more, whole. It's a lot more comprehensive in evaluation, and then figuring out what kind of treatments does this person really need. Do they need their prescription drugs, or can we start weaning them off as we're shifting their diet? Or do we need to increase their oxygenation? Or do we need to give them some vitamin therapy? I mean, what is going on? What do we need to give this individual to really heal at the cellular level? And I will tell you that majority of my patients, once we're kind of working through all these layers of cleaning out, the bottom line is that they need emotional work. The emotions that we carry, the fear right now that is there because of all the drama that's going on around the COVID-19 and the loss of work for so many, and access to food in some areas and to some families, and the reduction in education to our kids and childcare. And I mean, the list goes on. It is devastating for some of us, and it creates a lot of fear. But what message I want to get to people is that if we can move away from the fear, if we can rise above the fear, you see, fear has a very low frequency. It's one of the most lowest frequency vibrationally. Cancer has a very low frequency. Viruses and bacteria have a very low frequency. But our spirit, our soul has a very high frequency, right? So if you've got these viruses vibrating at this level, and we're up here vibrating from a spirit, from a soul, from a spiritual perspective, shifting our emotions from fear to being, to love, to giving, to compassion, to unity, to trust, to faith, we're elevating our spirit, our soul, then there's the chances that we could actually be affected in a very deep manner from the vibration of these frequencies of these viruses, it becomes very, very low. The chance becomes very low. So the more we can pray, the more we can meditate, the more we can breathe and just really trust that, you know, the power above, whether you want to call it God or the supreme being or whatever is your name for that entity or that power, that power, there is a wisdom in it that we may not understand right now, but as we elevate our spirits, and there's something to be said, by the way, about this collective spiritual elevation. You know, that collectively we need to elevate our souls.
It's
that
true.
The way we do that, the more we do that, the more these things just kind of don't find a need to be here right now anymore.
I think that is one of the most important things, honestly, that any doctor could say right now. And I'll tell you why. I took a survey, and I'll make this quick and we're going to wrap it up. I took a survey of my community, and I went in nextdoor.com. I have to say, of all the social media platforms, I felt that there was so much fear and division and confusion, and that feeds off each other. It affected me emotionally. Like, I got my feelings hurt, you know. I felt like I stepped into a virtual snake pit. So that emotion, speaking of that, let's say things are not available to people right now, and they may be out of work, and people may be struggling at this very moment. If they were to want to do a fast, and this would be a really good time to maybe just cleanse the body and, you know, be at peace with everything, what would you leave us with for a solution? Maybe now for fasting is what I can think of.
Well, fasting is great. Getting back to the roots of, you know, just even saying prayers and meditation and drinking water. Water is huge, right? And sending love to your water as you're drinking that water, and giving yourself positive affirmation and recognizing that you're not alone, that we are all in this thing together. You know, I mean, there's moments where I feel anxious and like, what if? And then I realize, you know what? It's not just me. We're all in this together. And so we all need to elevate and work together to rise above this. And we have the capacity to do it. If you look back in history, I mean, there's been moments in history, Spanish flu, and there's been, I mean, so many of these pandemics throughout human history, and every time people have overcome it, the humanity has overcome it. And this is another one of those that's pushing us to our limits to become better than we were before, to arise to our calling, which is we are spiritual in essence. And if we can get there, this will be, this will vanish away. There will be no need for it. But, you know, I do recognize that people from all over the country may not have access to integrative or holistic physicians like ourselves. And one of the things that we're doing during this COVID-19 is we're providing a very low $30 telehealth visit for patients who don't have insurance. Those who have insurance, the beauty of this COVID-19 procedures has been that we can provide advice and medical advice through the internet, through telehealth, to anyone that needs it. And those who don't have insurance, for us, we're just charging a minimum of $30 for 15, 20 minutes of consultation, which you know, does a lot of people a lot of good. So if you need that, please do reach us at holistichealth.com. And holistic, again, is spelled with the French spelling holistique, with Q-U-E at the end, holistiquehealth.com. And we'll be happy to help you. There are 7 of us doctors here at this clinic in Bellevue, Washington, and every one of them, I can say that not only do I love deeply, but I appreciate the amount of knowledge that they have and the sacrifices they make for people out there to help them. So don't be afraid. It's to reach out and help us help you.
Thank you so much, Doctor. My NB's in the house. All right, guys, we're going to wrap it up. We thank you so much for listening to this, and reach out to doctors. She has a wonderful staff. I'm so excited about what they're doing. Holistique.com. This is Rachel Seller, the forensic nurse, signing off. Stay right there, Doc.